here's an introduction to the Matrix Gait Trainer. Now, there's a lot of different parts and pieces and adjustments that we're going to use, so just so you can get a little bit more familiar with it. Now, we'll start with the armrest. We know we can adjust it by unscrewing here, both sides, and adjusting it to the patient's height, right? And you'll be able to do this on either side. Once you bring that back down, go ahead and place it in, spin it in, lock it in, and it should be good. Same thing with the person, depending on their build, we have these cams in the middle here that we may either have to move out more to the side or move in just to accommodate about hip width apart of their stance. Same thing would apply on the bottom part. Now, when we look at the frame, we notice that the back side of the frame is wider than the front. This is to keep it from tipping. This is really important, and even the feedback over the years on neurological patients feeling fearful of getting on some sort of walker during gait training because they feel like that's going to tip, or they even have felt it tip. So a lot of times if we're guarding, say they lose their balance and then we're trying to guard them, this will typically go sideways. This device, one, weighs 28 pounds, and two, the wheels being outside a little bit more free it from completely trying to move, so it does weigh down a lot more, so patients do feel a lot more comfortable. This is meant specifically for smooth surfaces. This isn't like an all-terrain thing. This is meant for training or in-home use without any of the devices for stability. You'll notice that on the wheels, it does not rotate. It's a four-wheel walker. There's no brakes, but it's meant for everything to just glide forward, okay? The reason being is because we want to provide as much stability as we can, especially with those learning how to walk again. They want to feel, obviously, they don't want to feel things shake. They don't want to feel things pivot. You want to make sure that everything feels safe, forward pattern. Yes, when you start training in other avenues, you'll do multi-directional movements and all that, but the initial part is to let them feel comfortable as they're translating, they're moving forward. On the other hand, when it comes to the full-on device, this is meant for full weight bearing. This is not your typical, whether you're suspended in a harness, maybe you're in a supported chair. This is meant to provide full weight bearing and allow for one practitioner. So even with more advanced patients with neurological conditions, having them stand up in this position, you can essentially control them and the device safely without needing an extra pair of hands, okay? The bungees are going to do what they need to do. If you need assistance moving the leg forward, the bungee is going to help it move forward. If you need to lift a little bit more, you'll be able to use a knee strap. So the idea behind the creation of this was to allow for safe gait training with one practitioner and allow for full weight bearing initially to get faster recovery. So in any case, whether you're working with Parkinson's, spinal cord injury, stroke, MS, there's a lot of other neurological conditions. You know, the guarding will depend on what the patient's presentation is. So if they're, left side is affected, you can stand on the left side to guard. If you need to facilitate, if you need to advance, there's a lot of things that you can do in that position. If you need to stand from behind, maybe they're not as affected with weakness in the legs, maybe it's overall trunk support, you can be from behind even controlling. So there's ways that you can control and find, do I need more support on the person's trunk, or do I leave a hand for guarding and actually control more of the device to make sure that they're advancing the device forward, to keep that tension that's going to allow them to move their foot forward as they go through the gait cycle. Now, when training, considering obviously comorbidities, there's a lot of other factors that can come about, but this is meant for initial gait training. And the idea is that using this device is an easier transition onto a walker or another assistive device, because they're actually using something that looks and feels like a walker, versus if they're suspended in a harness and they go back down into a walker, that transition from a neurological standpoint is going to be much different than what they were used to. So these are different ways, and just more of an introduction how to use the device. There's many different ways that you can use it. I've seen people use it in ways that I don't typically use it, but it's still really effective. But overall, it's a really good tool for initiating and creating good mechanics and having the person have a good foundation when they initially start to learn how to walk.